I'm George Thibault, privileged to be chairman of the board of the MGH Institute of Health Professions, of which I am very proud. This grand opening of this clinical center represents the next evolution of the MGH IHP's vision for how both care and education should be performed in the 21st century. This is the 21st century vision of how care and education are united in a physical structure that is designed for interprofessional care of patients and interprofessional education of our students. In this beautiful facility, residents of Charlestown and Greater Boston from the ages of 2 to 90 will be able to receive screening, rehabilitation services, education free of charge. The IHP already provides $1 million worth of services, but now, united in this building, those services are all under one roof to improve patient care and to improve education, and will probably double the amount of free service that will be provided. We are very proud of this commitment to the community, and carried with it is the commitment to our students. They will be educated in an interprofessional way in these beautiful facilities that are set up to both foster good patient care and good education, on the belief that the environment that provides good care also provides good education. So we're very proud of the accomplishments of the Institute, very proud of this building and this resource as an expression of the values of the Institute. And we're very happy that you're all here to celebrate with us. I'm now going to hand the mic, the podium, over to our wonderful new president, Paula Malone-Nuzzo, who's been here all of 2 months and already having a great impact. And we're so pleased you're here, Paula.
Thank you so much, George. Thank you. I'm so honored to represent the IHP tonight as we open this incredible learning space for our students. This space, where we provide important clinical care to clients and through that care educate our students, represents our commitment to one of the founding tenets of the IHP, interprofessional education. We know that healthcare professionals have traditionally not been educated in teams to provide care. As a result, care is often fragmented, sometimes duplicative, high cost, and without optimal outcomes. IHP is committed to transform healthcare through the education of expert clinicians who will practice in teams and improve patient care outcomes. Our graduates are poised to transform healthcare delivery. The design of the center reflects our belief that clinicians must be able to function as members of interprofessional teams, and that their education in the context of collaborative practice is essential to their developing a broad understanding of the healthcare delivery system. In this center, there will be opportunities for our nursing students and our physician assistant students to provide health assessments and to collaborate on screening, wellness, and prevention activities. There will also be opportunities for our physical therapy students, occupational therapy students, and speech and language therapy students to work collaboratively to plan and implement care for a patient who experienced a stroke, and the list goes on. This Impact Practice Center will provide transformational opportunities for students and faculty across programs and disciplines to work, plan, study, and practice together. When our students arrive at the Institute, they begin their studies engaged in a course that spans their entire program called Impact. It is through this curriculum that they acquire knowledge and skills about practicing in a team. That is why we've named this new center the Impact Practice Center. There are several people who must be recognized because without their efforts, we would not be here this evening. I want to thank Jan Bellick, the former president and president emeritus of the IHP, whose vision and commitment to interprofessional education led the development of this center. I also want to thank Provost Alec Johnson, Dean Leslie Portney, Dean Inez Tuck, Dennis Stratford, and the entire Impact Center practice team for making this center possible. Please join me in giving them a round of applause. The center also allows us to recognize and celebrate our supporters with plaques throughout the center. I hope you have a chance to take a look at the different plaques around the center that talk about our donors who have sponsored specific spaces and equipment. And with our first donor wall, recognizing all who share our passion for improved patient care and have made contributions to support this new space. The center is a fitting tribute to our founders, whose inspirational vision for an interprofessional graduate school resulted in the MGH Institute of Health Professions. We are profoundly and deeply grateful for those who have invested in the IHP over the years with their philanthropy and helped position the IHP for the success it has achieved to date. Tonight, we are especially pleased to reveal the IHP's first donor wall, recognizing those who have made gifts so far in this, our 40th year. I hope you all have a chance to walk by there and take a look at the donor wall and take a look at the many names who have made this night possible. Now I'm pleased to introduce Sheba Arnold. Sheba and her husband and 2 boys live in Burlington, Massachusetts. Her oldest son, Danny, was diagnosed with autism spectrum disorder when he was 4. He has been a client of our Speech, Language, and Literacy Center now for 3 years. We've asked Sheba to share her perspective as a client of the center. Sheba? Thank you so much.
So I want to begin by thanking the organizers for giving me the opportunity to share this experience. Danny was diagnosed with autism spectrum disorder at age 4, and soon after we found out that he is a special needs child. We found the best available facility in our neighborhood. He started going there, but within a year we found out that he has made little progress. And what was hard for me as a mom was each therapy session was just so hard. He would rail against it, and just getting him in and out of therapy was so hard for me. So I got a referral to this wonderful program through a friend, Margaret Kelgard, and she put me in touch with Leslie Maxwell. And now Danny's a different boy. He's eager to come for therapy. I know he considered it. He considers it as a play date almost. So he says first year, it was Lindsay and Sarah, so he would say, I'm going to play with Lindsay and Sarah. And the next year it was Bob and Heather, so Bob is here. And it was just amazing for me to see this transition as a mom. So I want to express my heartfelt thanks to MGH Institute and what has been a philosophy shift for me, that as a mom I was super focused on closing his gaps, but then the philosophy shift happened as to when Leslie told me something so profound that as a child he might have some hidden strengths, and we will also work on enhancing his strengths. So I'm deeply, deeply thankful to Leslie, and I think Leslie is a miracle worker. Not only that she's a miracle worker, she generates miracle workers year after year after year so that they could go to the real world and carry this great work. And a word about donors, you are the lifeblood, I think, of any educational institution. Without philanthropy, not much can be accomplished at this great level. So thank you all the sponsors, benefactors, and thank you once again for the opportunity to speak.
Thank you, Sheba. Great story. I'm so glad your son is doing so well. It's my distinct honor and privilege to introduce the Honorable Mayor the Honorable Martin J. Walsh, Mayor of the City of Boston. As many of you know, Mayor Walsh was elected as mayor in 2014 after having served as a member of the Massachusetts House of Representatives for 17 years. Born and raised in Dorchester by immigrant parents, Mayor Walsh is driven to make sure Boston is a city where anyone can overcome their challenges and fulfill their dreams. This is not unlike how our faculty and students help our clients overcome their challenges and work towards their dreams. Thank you for being here with us tonight. Mayor Walsh.
Thank you very much, Dr. Nuzzo, and congratulations on becoming the new president here at the Institute. And it's you can tell, I was walking around, this is an exciting place to work. I also want to thank you, Dr. Tebow, for your great work on the chair, all the work the chair does. Sheba, you did an incredible job speaking here. It's great to hear that Danny's doing good and great, and it's great to hear that story because people understand the miracles that happen here. And Leslie, thank you as well for your great work. And I don't think you can get a better compliment than when a mother sees a change in their child and gives credit to the people who are helping them. So thank you. And to all the students here, great job to all the students as well. So how about a round of applause for the students, because they're the ones who have it the toughest here. We all get to go home tonight and watch baseball or something. They have to go study or something like that. So, good luck. I want to, my mother would have loved if I was a doctor instead of the mayor, but I didn't do it, so. I want to thank all the health professionals for their commitment to the Boston residents. This is a very special community of caring professionals, and that provide top quality care and cutting edge improvements in treatment and specialize in rehabilitation and therapy of all ages. And I'll tell you, I have a different appreciation for therapy, and as I was walking around today, I was thinking about it, and I'll tell you why. Back in August, my mother got sick, and she had a stroke, and she was treated at the Mass General, first the county hospital, and then the Mass General was beyond the time they could give her the medicine to relieve the pressure. Anyway, they did surgery on her, and after the surgery, the doctors came in and the physical therapists came in talking about a plan that they would have potentially to put my mother on. It turned out she had a full recovery within 48 hours. She's a tough Irish woman. But just knowing that people were there and the professionalism of these workers and these physical therapists and these doctors and nurses, and you can tell the training is so vitally important. And the way that young people and professionals are trained makes the world a difference, because you don't know when that training is going to take effect. You don't know when that training is going to come in handy. I want to thank you also for being a great neighbor and working with a thriving medical community. This institute is working with the Harvard Kent School, which is a level 1 school right around the corner in Charlestown. This institution is working with Bunker Hill Community College, a program that with Bunker Hill we have worked to give free community college to our graduating seniors if they want to go to community college. Again, having a connection like this is important. Spalding Rehabilitation. The president's here tonight. I don't know if he's still here, but thank you, Spalding, for all the great things you do. Obviously, Mass General and many other partners in the area. They also host a Community Impact Day, where students devote many hours to service to nonprofits. And you think about that, a lot of them are doing it right now when they're treating, I was just in the physical therapy room, and we're talking about patients that couldn't afford or don't have eligibility to get into physical therapy. They can come here and get the greatest care in the world right here in this facility here in Charlestown. So again, I want to thank you for that. MGH Institute trains tomorrow's healthcare leaders. The center brings kids from all ages and people from all ages all across different health backgrounds, and I want to thank you for that. With things that are going on in our country right now, a lot of uncertainty in our country, in the state of our healthcare system nationwide is certainly bothersome. Especially when, as Massachusetts was the first state to have universal health insurance for people. I was proud to take that vote as a state representative, and when you think about it, people are concerned about their care, but not necessarily here, not in this facility, certainly, and Boston's leading the way in so many different ways, as far as compassionate and accessible treatment, and setting a strong example for the nation. So again, I want to thank you. And that's what this center represents. So I just want to thank you again. I want to thank MGH for continuing your investment here in Charlestown and Greater Boston. I want to congratulate you on 40 years of serving our community and serving their community. I want to thank you for being such a wonderful partner in providing free, accessible health care to the residents. And to all the folks that's names on that wall, I want to thank you as well. I want to thank you for your commitment and support as well, because we know that facilities like this don't get built by accident. They get built with a lot of love, a lot of care, and a lot of people's commitment. So again, thank you very much, and I look forward to coming back. We cut the ribbon now, right? We cut the ribbon? All right. Let me move this out of the way. We need a pair of scissors.
Who's got the scissors? Who's got the scissors?
Where's Liz with the scissors? Oh, there's.
The gold scissors.
You tell them to the hospital, you got the protection on the scissors.
Okay.
Anybody else?
No? No?
All right. All right?
Yep. So, it is officially open, though people here know that it's been in use since the first week of September. It's already helping people and already teaching students. I want to thank the mayor for your presence. You honor us by your presence, and you acknowledge the commitment of the Institute to serve the community. And having you here validates that and lets us know that you and the community appreciate that we are here to serve the community. That, in fact, is why organizations like this exist. And it's the lesson that we, of course, want all of our students to learn, and they are learning it here. So thank you for your presence, and thank you all for being here, and thank all the donors, and there's more to come. We actually haven't finished all of our dreams and all of our projects. So those of you who've contributed, we say thank you. Those of you who haven't, we hope that you'll step forward and contribute to this great, great institution. Thank you all, and have a good time.